Have you ever brushed your teeth, spit into the sink, and seen a worrying tint of pink or red? You're not alone. Bleeding gums are incredibly common, but that doesn't mean they're normal. It's often the first sign your gums are calling out for help. So, what's really going on in there? Stick with me because today we're diving deep into the reasons why your gums might be bleeding, and most importantly, I'll share the simple, effective steps you can take to stop it and get your gum health back on track. Make sure you watch till the end to learn how to protect your gums and your smile for the long run. First, let's get one thing straight. Healthy gums don't bleed. If they do, the number one culprit is usually a buildup of plaque. Plaque is that sticky, invisible film of bacteria that constantly forms on your teeth. If you don't remove it effectively every day, it hardens into tartar, which you can't brush away on your own. This plaque and tartar buildup along the gum line is what irritates your gums, making them inflamed, tender, and prone to bleeding. This initial stage of gum disease is called gingivitis. The good news about gingivitis? It's completely reversible with good oral hygiene, but if you ignore it, it can progress to a much more serious condition called periodontitis, which can lead to tooth loss. So, how do we fight back against plaque and stop bleeding gums in their tracks? It all starts with your daily routine. Let's talk about brushing. Are you brushing at least twice a day for 2 full minutes each time? That's the gold standard. Use a soft-bristled toothbrush. This is non-negotiable. Many people think a hard-bristled brush cleans better, but it can actually damage your gums and enamel, causing them to recede and bleed. Think of it as massaging your gums, not scrubbing them. Use gentle, circular motions and make sure you're angling the brush at 45 degrees towards the gum line. This angle allows the bristles to sweep away plaque from that critical area where the tooth meets the gum. An electric toothbrush can be a game changer here, as many have built-in timers and pressure sensors to ensure you're brushing correctly and not too hard. Now, brushing is fantastic, but it can't do the job alone. It only cleans about 60% of your tooth surfaces. What about the other 40%? That's where flossing comes in. Flossing is your secret weapon for cleaning between your teeth and under the gum line, which are prime spots for plaque to hide and cause inflammation. I know, many people find flossing a chore. But if your gums are bleeding, it's the most direct way to target the problem areas. When you first start flossing regularly, you might notice more bleeding initially. Don't be discouraged. This is actually a sign that you're clearing out the bacteria and irritation. Keep it up, and within a week or two, you should see a significant reduction in bleeding as your gums become healthier and stronger. To floss correctly, take about 18 inches of floss, wrap it around your middle fingers, and use your index fingers and thumbs to guide it. Gently slide the floss between your teeth. Don't snap it down onto your gums. Instead, curve the floss into a C shape against one tooth and slide it up and down, going slightly below the gum line. Then do the same for the adjacent tooth before moving to the next gap. If you struggle with traditional floss, don't give up. There are fantastic alternatives like floss picks, interdental brushes, or even a water flosser, which uses a stream of pressurized water to flush out plaque and debris. The best tool is the one you'll actually use consistently. Your diet also plays a surprisingly large role in your gum health. A diet high in sugary and starchy foods feeds the bad bacteria in your mouth, accelerating plaque formation and contributing to inflammation. Think of sugar as fuel for the bacteria that cause bleeding gums. On the flip side, a balanced diet rich in vitamins and minerals can boost your body's ability to fight infection. Vitamin C in particular is crucial for collagen production, which helps keep your gum tissue strong and resilient. So, load up on fruits and vegetables like oranges, strawberries, bell peppers, and broccoli. Vitamin K, found in leafy greens like spinach and kale, is also important as it aids in blood clotting. So, eating a healthy, balanced diet isn't just good for your body, it's essential for a healthy mouth. Beyond the basics of brushing, flossing, and diet, there are other factors that can contribute to bleeding gums. Certain medications, like blood thinners, can make bleeding more likely. Hormonal changes, such as those during pregnancy or puberty, can make gums more sensitive and prone to what's called pregnancy gingivitis. Even stress can impact your immune system, making it harder for your body to fight off the bacteria that cause gum inflammation. If you smoke, this is one of the most significant risk factors for developing severe gum disease. Smoking weakens your immune system and reduces blood flow to the gums, hindering their ability to heal. Quitting smoking is one of the best things you can do, not just for your overall health, but specifically for your gum health. Let's also talk about using an antiseptic mouthwash. While it's not a substitute for brushing and flossing, a therapeutic mouthwash can be a helpful addition to your routine. Look for one that's specifically designed to reduce plaque and fight gingivitis. Using it after brushing and flossing can help kill bacteria in hard-to-reach areas and give your mouth an extra level of protection. Swish it around for the recommended time, usually 30 to 60 seconds, to give it a chance to work its magic. This can help reduce the overall bacterial load in your mouth and soothe irritated gum tissues. So, to recap the action plan for stopping bleeding gums. First, upgrade your brushing technique. Use a soft bristled brush. Brush gently for 2 minutes, twice a day, angling the brush towards the gum line. Second, commit to daily flossing. Clean between every tooth, every day, to remove the plaque that brushing misses. Be patient if you see some initial bleeding. Third, evaluate your diet. Reduce your sugar intake and boost your consumption of vitamin-rich fruits and vegetables to support gum healing from the inside out. And finally, don't forget the most important step of all, regular dental checkups. No at-home routine can replace a professional cleaning. Your dentist or hygienist can remove the hardened tartar that you can't, assess the health of your gums, and provide personalized advice. If your gums continue to bleed despite your best efforts for a couple of weeks, it is absolutely crucial to see your dentist. They can rule out any more serious underlying issues and get you on the right treatment plan. Remember, bleeding gums are a warning sign, but they're one you can definitely address. By taking these proactive steps, you can eliminate the bleeding, reverse gingivitis, and build a foundation for excellent long-term oral health. A healthy smile starts with healthy gums, and you now have the knowledge and the tools to make that happen. Thank you so much for watching all the way to the end. I hope you found these tips helpful. If you did, please give this video a thumbs up, and don't forget to subscribe to the channel and hit that notification bell so you don't miss out on more tips for a healthier, happier you. Let me know in the comments if you have any questions or your own tips for great gum health. Take care, and I'll see you in the next video.